The news from the coronavirus is not very good today. Cases continue to rise nationally and regionally. And because of that, we will pause some of our reopening plans until it is clear how much of this is going to affect us here in Philadelphia. Let me give you some background starting first with numbers. Since this time yesterday, we've had 142 new cases of the coronavirus infection diagnosed in Philadelphia residents, bringing us to a total of 26,133 since the beginning of the epidemic. Now, in the past couple of weeks, our cases are more likely to be younger people, such as teenagers and young adults. In the past 2 weeks, 34% of our cases have been under the age of 30 versus 20% for the epidemic as a whole. To the extent we can understand where this is being transmitted among young people, it's been linked to social events and to travel, and particularly travel to the Jersey Shore. Since this time yesterday, we've confirmed 5 additional deaths from the coronavirus infection, bringing us to a total of 1,584 since the beginning of the epidemic. Now, our daily case count is no longer falling. For the week that ended just last Saturday, there were a total of 740 cases that were reported to us. So an average of just above 100 per day over that 7-day week. That's 740 is an increase from 725 the week before. Not a big increase, but that is an increase, and it's a change from what we were seeing before that. Elsewhere, this epidemic has signs that are even worse. Case counts in the U.S. as a whole over the past 14 days have risen more than 80%. Case counts are surging in Florida and Texas. These are states that had initially peaked at about 1,000 cases per day, and now are seeing more than 8,000 cases per day. And the rise is not just a steady rise, but in fact, it's accelerating. Closer to home, we're seeing case counts rising in the entire state of Pennsylvania, in New Jersey, and in Delaware. And we're seeing a surge in cases in Allegheny County. Now, the outbreaks in other states are linked in particular to social events and to restaurants and bars. These are places where people are close together inside and not wearing masks because they're eating and drinking. This has prompted states of Texas and Florida to close bars, and similarly, Allegheny County has closed indoor drinking. New Jersey has postponed what they had scheduled before, the reopening of indoor dining and restaurants. Back here in Philadelphia, unfortunately, the targets we laid out to go to green will not be met by this Friday. We have not had a steady decrease in cases over 4 weeks, and our daily case count looks like it will not be below 80. Our response to this includes what we discussed last Friday. We're reminding first businesses and activity managers that they are required to enforce a variety of safety precautions, including distancing among people and mask use. A mask media campaign, which will launch very soon. An executive order that we passed last Friday requiring people to wear masks when they're indoors in public places or outdoors within 6 feet of other people. A recommendation that people in Philadelphia not travel to high incidence areas, and that people traveling from high incidence areas coming to Philadelphia self-quarantine for 14 days. There's a map that's posted on our website that indicates what are the states that we consider to be high incidence areas. An additional step we're taking as part of this precaution is that we will not be allowing restaurants to permit indoor dining as of this Friday, which we had tentatively scheduled before. Now, there are 4,200 restaurants in Philadelphia that have indoor dining under ordinary circumstances. If we would allow people to congregate in there without masks, that might catalyze another surge in cases. It could be as bad as we saw here last April or worse. It could overwhelm our hospital system. It could increase deaths. And to prevent that, it could force us to shut down again. We think it's better for us to be cautious now than, like Texas and Florida, open up restaurants and regret it later. We still will allow restaurants to allow delivery and takeout and outdoor dining. We will also put a pause on reopening gyms and fitness centers. This is because there's evidence that vigorous physical activity that causes you to breathe fast puts people nearby at risk. And now there's no one that promotes exercise that is more interested in exercise than us here at the health department. We're very enthusiastic about exercise, but we'd encourage people to get their exercise outdoors. Now, we will pause these activities until August 1st, but we'll reevaluate weekly based upon the trends in the epidemic across the nation as well as locally to consider whether there's any reason we might want to reopen them earlier than that. Other than that, we will move to a modified, restricted version of green as initially laid out by the governor. We will allow some of the lower risk activities that were included in green. And those activities tend to be outdoors or where masks can be worn and enforced. That includes museums and libraries. It includes indoor shopping malls. It includes the city's casino, but only under very strict safety requirements, requiring people to mask at all times, requiring people to maintain a social distance of more than 6 feet at all times, and absolutely no food, no drink, no smoking indoors. And outdoor gatherings of up to 50 people. These are things that will be allowed starting this Friday. All those activities must follow our safe mode guidance. Remember, there are 8 items in the safety checklist for that safe mode guidance that includes, most important, masks. It also includes steps to reduce crowds, to enforce distancing between people, to put barriers between people, such as those plexiglass barriers you see at cash registers, and other steps. Now, we have been working and will continue to work directly with schools and colleges around their reopening plans to ensure that they're going to be safe. And we continue to recommend that everyone who can work remotely continue to do so. If you can stay safe at home, this is still the time to do it. And I want to make very clear here today that if cases rise here in Philadelphia, it is possible that we will have to backtrack and close activities that we are currently allowing or that we are starting to allow reopening as of Friday. Now, the big picture here, if you think about it, is that it's clear we will be living with this virus for a long time. We will not eliminate it here in Philadelphia. We'll not eliminate it nationally. We'll not eliminate it regionally until we have a vaccine. Fortunately, most people who have this infection have a mild infection or they recover. And fortunately, our healthcare system is more experienced now than it was a few months ago in how to treat this infection. If we can't eliminate this virus, we have to do everything we can to protect the people who are most likely to have a severe case, the people that we call our vulnerable populations. That gets back to the third part of our strategy for combating the coronavirus. There's 3 parts of our containment, social distancing, protecting vulnerable populations. Now, we will continue to work and have been working with nursing homes and other congregate care facilities to prevent spread in those facilities. But many vulnerable people are living at home. And so I want to emphasize the importance of those people of staying safe. People who are considered to be vulnerable at home are people over the age of 65, people over the age of 50 who have diabetes or another chronic illness, or people at any age with immune deficiency, such as people who have undergone cancer treatment. Our recommendations for them are, don't let COVID into the house. Stay home, don't go out for errands, and don't allow your household members to pass on the infection to you. So your other household members should stay home as well as much as possible. And when you're around your household members, if they've been out of the house, you should wear a mask, and your household members and caregivers should wear a mask as well.